The government now directs over 60% of the health care in this country. And if throwing money at it and creating new government programs could solve it, we wouldn't be sitting here today, because we've done all that. It hadn't worked. So what I thought we ought to do is maybe talk about, why does it cost so much? Because the thing that keeps people from getting access to care in our country is cost. You mentioned Malia and Sasha. The fact is with young kids going to the ER, whether they have meningitis or asthma, they're going to get treated in this country. But they may get labeled with a pre-existing illness after that. And that's another thing I'd be happy to talk about at a later time. Mm-hmm. But the fact is we know how to treat acute asthma. What we don't do a good job of is preventing children from getting acute asthma. We don't do the good job of prevention. Mm-hmm. So when you break down the costs, what we know is 33% of the costs in health care shouldn't be there. And how do we go about doing that? And what are the components of that cost? And when you look at when it's studied, and if you look at what Malcolm Sparrow from Harvard says, he says 20% of the cost of federal government health care is fraud. That's his number. If you look at Thomson Reuters, when they look at all of this, they say at least 15% of government-run health care is fraud. Well, when you look at the total amount of health care that's government-run, you're talking $150 billion a year. So tomorrow, if we got together and fixed fraud, we could cut health care 7.5% tomorrow for people in this country. So what we ought to do is do the Willie Sutton thing. We ought to go for where the money is. What's the other area? What we do know, and I'm guilty of this, Dr. Barrasso's guilty of it, Dr. Bustiani's guilty of it, is a large portion of the tests we order every day aren't for patients. They're for doctors. And the reason they're there is because we are risk averse to the tort system and extortion system that's out there today in healthcare. And there are a lot of ways to fix that. But I just went through last night. If you add up what Thomson Reuters, which looked at all the studies that have been done and combined them in, they say between $625 billion and $850 billion a year of healthcare dollars are wasted. So it seems to me if cost is the number one thing that's keeping people from getting care, then the efforts of us as we go after cost ought to be to go to those areas where the cost is wasted. And there's a philosophical difference in how we do that. One wants more government-centered approach to that. I would personally prefer a more patient-centered, market-oriented approach to that. But nevertheless, there's where we can come together, just on those two areas where we could cut costs 15% tomorrow. And that's for everybody in the country. What would happen to access in this country if tomorrow everybody's health care costs went down 15%? Access would markedly increase. So what I would hope we would do is that we would go back and concentrate on the areas that have the biggest pot of gold for us. And the biggest pot of gold is we don't incentivize prevention. We don't pay rewards for a great management of chronic disease. We have a system throughout the country where we're encouraging lawsuits that aren't productive for the country, and what they actually do is cause the cost of health care to go through the roof. We also know there's some other real things that we ought to address. There are conflicts of interest within the medical field. There's nothing wrong with addressing those and taking those off. We know that we absolutely do not incentivize prevention. And I'm not talking about creating walking paths. I'm talking about paying people who actually do a good job to do prevention. Talking about changing the school lunch programs where it meets the nutritional needs of Americans. Changing the food stamp program where it incentivizes people to eat the right things, not the wrong things. We actually create more diabetes through the food stamp program and the school lunch program than probably any other thing, because we're not offering offering and incentivizing a great response. So I think I think it's great that we're coming together, but the gold is in where's the cost excesses. And what I would hope we would do is we would look at that and say, how do we come together and actually achieve a reduction in the extortion that goes on in this country in terms of medical malpractice? And there's lots of ways to do that without us mandating to the states. I know some of you have some of that in this New Thoughts in terms of incentivizing states to do that. How do we do that in terms of creating an elimination of fraud? You know, when you compare the private sector fraud rates, it's 1% compared to Medicare and Medicaid. You know, there's estimates that there's $15 billion worth of fraud in Medicaid a year in New York City alone. So we haven't attacked that. We haven't gone where the money is. And my hope would be that we would look at where the money is. And if truly it's accurate, and I don't know many people that will disagree that $1 and $3 doesn't help somebody get well and doesn't prevent them, then we ought to be going for that $1 and $3. And we ought to do it not by creating a whole bunch of new government programs, but by creating an incentive to reward people. You, in your new bill, you have good fraud programs, but you lack the biggest thing to do. The biggest thing on fraud is to have undercover patients, so that people know we're checking on whether or not this is a legitimate bill. And you don't know who's an undercover patient and who's not. And all of a sudden, you start changing your attitude of whether or not you're going to milk Medicare or you're going to milk Medicaid. So,
Mr. President, if I could just say that I'm not an expert on much, but I am filibusters, and we have 40 members of Congress here.
Tom, you made some powerful points. You want to just wrap up real quick?
No, I'll just finish with that. Is with $1 out of $3 not helping everybody, we ought to go for where it is.
Well, Tom, I appreciate what you said. I think we're going to have Steny Hoyer go next. I just want to make this quick point. Every good idea that we've heard about reducing fraud and abuse in the Medicare and Medicaid system, we've adopted in our legislation. So that's an example of where we agree. We want to eliminate fraud and abuse within the government systems. Let's recognize, though, that those savings in the government systems, which will help taxpayers and allow us to do more, doesn't account for the rising costs in the private marketplace. Now, the private marketplace, you mentioned the issue of medical malpractice and frivolous lawsuits, and as you indicated, these are areas where Secretary Sebelius has already begun to try to give states some incentives to do that. On the prevention side, there's a whole host of provisions inside the legislation that's been passed by the House and the Senate, and I think Steny will talk about it. So we've identified some areas we agree on, and then the question just is, does that help the average family in the individual market who potentially can get costs? But Steny, why don't you...
Let me just respond to one thing. You get cost shifted every penny that gets wasted in Medicare. And that gets cost shifted to the private sector. So if, in fact, we're wasting it in the public sector, we're shifting it to the private sector.
You and I agree on this. Steny?
Mr. President, thank you very much. A quote I will use is, we should have available and affordable health care to every American citizen, to every family. I suppose there are a whole lot of every Americans and American families listening to us today and watching us. And they're hoping the world is sitting around here talking about them, not about us. That's the message they're sending to all of us. And they're absolutely correct. And we believe that we have been addressing them and trying to get some of these stories that all of us hear to a place where they won't be so tragic for individuals and for families. Every one of us has a story. I had a message on my telephone answering machine just a little while ago, a couple of weeks ago. A woman that I know well called me up. She said, Steny, I was just diagnosed with a tumor, and I've got to be operated on. I don't have any insurance. My husband makes $28,000. I work part-time and make about $5,000. She says, we're making too much money from Medicaid, and we're going to go to the University of Maryland Hospital. They want 50% down of a $25,000 bill. She doesn't have that. And we're working on that, trying to get her some additional help. Hopefully we can. I had a small business in my district, like all of you, who last year paid $1,100. Couple, healthy, paid $1,100. Their bill is